Hello, my name is Jorge Daniel González Pérez.
And my name is Hugo Rolando Melchor González.
We are from Medicine School, Tier Grade Group B, and today we are going to talk you about cancer.
And we will cover points such as etiology, pathophysiology, epidemiology, symptoms, clinical manifestation, diagnostic, and treatment.
The word cancer comes from the Greek karkinos, which means graft. Hippocrates described it as an ulcerous injury which develops progressively and out of control, and expands to other tissues. The cancer is considered as a cellular replication disorder where cells divide abnormally, producing an abnormal tissue growth, making significant changes in the physiology of the organ which is affected. Also, these cells can migrate and invade other tissues in order to continue its growth. This is called metastasis. The most common types of cancer are pulmonary cancer, prostatic cancer, colorectal cancer, breast cancer, cervical cancer, and thyroid cancer.
Hello, I'm going to talk about the etiology of cancer. Cancer is caused by genetic alterations that can be inherited, induced by environmental factors, or the result of errors in DNA replication. A new study suggests that 2/3 of all cancer are caused by errors in the replication process, underscoring the importance of early detection and intervention to reduce the cancer-impaired deaths arising from unavoidable errors in the replication process of DNA. Talking about the environmental factors, there are a lot of them, like alcohol, sunlight, obesity, radiation, tobacco, immunosuppression, etc. And this is the etiology.
Now, let's continue with the pathophysiology of the cancer. The normal cells transform into cancer cells in a process called carcinogenesis. This transformation is due to mutations in the genetic material which provides to the cell the ability to divide faster than the other cells in the tissue and avoid the growth control from the body. These cells can also inherit these abilities to its descendants. Some of the processes that distinguish the cancer cell are independent growth factors synthesis. These cells can develop its own growth factor, making them independent from other cells to grow. Avoidance of stimuli that inhibit growth. Replication in normal cells is regulated by the expression of certain genes which inhibit replication when it's necessary. But in cancer cells, these genes are unable to inhibit replication. Invasion and metastasis. A reduction on the expression of an adhesion protein, specifically E-cadherin, produces the loss of adhesion of the cell to the epithelium, so the cell can invade surrounding or distant tissues. Unlimited capability to replicate. With every replication, normal cells lose small fragments of DNA, limiting its replication. However, cancer cells expresses a telomerase protein which is responsible for adding repetitive segments in the telomeric DNA, bypassing the replication limit in a process called immortalization. Sustained angiogenesis. Tumoral cells stimulate blood vessels formation, while this helps tumoral growth and metastasis. Immune system avoidance. Immune cells can detect and destroy cancer cells by recognizing its proteic patterns, but genetic mutations in cancer cells change these patterns and difficult its recognition. Besides, cancer cells expresses cytokines and chemokines that recruits inflammatory cells that inhibits immune system.
Now I'm gonna talk about the epidemiology. Unfortunately, cancer is one of the leading causes of death in the world. In 2018, there were 18.1 million new cases and 9.5 million deaths from cancer in the world. And it is anticipated that by 2040, the number of new cancer cases per year will increase to 29.5 million, and the number of cancer deaths to 16.4 millions. In general, the highest cancer rates are found in countries with populations that have the highest level of expectancy, education, and standard of living. But some types of cancer, such as cervical cancer, for example, the opposite is true. The highest incidence rate for this cancer is found in countries whose populations have low levels of measurements. The most common cancers in descendant order are breast cancer, lung and bronchial cancer, prostate cancer, colon and rectal cancer, and melanoma, that is the denominated skin cancer. Prostate cancer, lung cancer, uh, and colorectal cancer are estimated to account for 43% of all cancer diagnoses in men in 2020. The three most cancer in women are breast cancer, lung cancer, and colorectal cancer.
Some of the most common types of cancer include these symptoms: severe and persistent tiredness, night sweats and fever, persistent cough, changes in breasts like appearance of lumps or skin rashes and scalding skin that itches, changes in the bladder like dysuria or hematuria, changes in digestion like difficulty swallowing, hematochezia or nausea and vomiting, changes in skin like new appearance of nevus and jaundice.
Now I'm gonna talk about the clinical manifestations. There are a lot of them depending the kind of cancer, but I'm gonna talk about the most common clinical manifestations. There are changes in the intestine, like blood in the stool, changes in bowel habits. There are changes in the mouth, like a white or red patch on the tongue or in the mouth, bleeding, pain, or numbness in the lips or mouth. And also, there are neurological problems like headaches, seizures, changes in the sight, hearing changes, etc. Also, you can gain or lose weight for no reason. There are the most common clinical manifestations of cancer.
And now, let's talk about diagnostic. Some of the lab tests used to diagnose cancer include complete blood count. Measures the number of red blood cells, white blood cells, and platelets in the blood. It can help to diagnose some cancers, especially leukemias. Immunophenotyping uses antibodies to identify cancer cells based on the types of antigens or specific markers on the surface of the cells. Tumor marker tests. These tests measure substances produced by cancer cells or other cells of the body in response to cancer. Urinalysis measures the urine content such as sugar, proteins, red blood cells, and white blood cells. This can help to diagnose kidney cancer, bladder cancer, or urothelial cancer. Imaging tests are also used to diagnose cancer. Some of these tests are computed tomography. This scan takes a series of pictures to create detailed three-dimensional images of the organs to locate the cancer. Magnetic resonance imaging. This scanner can take pictures of the body in slices, which can show places where may be tumors. Nuclear scan uses radioactive material which is injected through the bloodstream and collects in certain organs. This can help to take pictures of the inside of the body. X-ray uses low doses of radiation to create pictures of the inside of the body. To diagnose cancer, it is also used the biopsy. This is a procedure in which is removed a sample of abnormal tissue in order to analyze it in the microscope. And finally, in the diagnosis of cancer, it is important to mention the screening tests. First of all, we have the screening mammography, which has been shown to reduce deaths from breast cancer. The human papillomavirus tests and pap tests are recommended cervical cancer screening tests that allows to find abnormal cells and treat them before they become cancer. Colorectal cancer screening include colonoscopy and stool tests to detect colorectal cancer early, reducing the risk of dying from this type of cancer. The prostate-specific antigen blood test has been used often along with a digital rectal exam for prostate cancer screening.
Now I'm gonna talk about the treatment of cancer. There are different treatments depending the kind of cancer, but the most common are surgery, chemotherapy, radiation therapy, hormone therapy, immunotherapy, and the most recently treatment is stem cell transplant using bone marrow transplant. The surgery is an operation in which doctors cut and remove tissue with cancer cells. The chemotherapy it uses special drugs that shrink or kill cancer cells. The radiation therapy uses high energy rays to kill cancer cells. The hormone therapy stops cancer cells from getting the hormones they need to grow. The immunotherapy is a treatment that works with the body's immune system to help it fight cancer cells or control the side effects of the other cancer treatments. And the last one, the stem cell transplant, replaces bone marrow cells that are lost due to very high doses of chemotherapy or radiation therapy, and it is often used to treat cancers of the blood and lymph nodes. And finally, a little conclusion is cancer, as mentioned, is a disease that causes millions of deaths, which is why its prevention is the utmost importance. It is necessary to treat it from the first symptoms and clinical manifestations. Today, there are numerous campaigns for its detection and even for its treatment. Its early detection is important in order to avoid many of the complications that it can have that health personnel can work more efficiently.